You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. My first guest is an expert on the topic of smile makeovers. And today we're specifically talking about this new trend of adult accelerated orthodontic, 6-month smiles, Invisalign, things like that. With us, we have Dr. Hoellrich. Dr. Hoellrich, welcome to the program.
Thanks for having me, Randy.
All right, now before we get into today's topic, tell me, for people that don't know you, a little bit about your practice, the different procedures you do, and who the typical patient is.
We're a general dental practice located in Grandview Heights, which is a small suburb of Columbus, near Ohio State.
Okay.
General practice, which means we do everything. I like to say that I'm a decathlon dentist, which means we do everything and do everything at a high level. If you need a filling, you need an extraction, you need dentures, implants, sedation, with a particular bent on adult orthodontics and cosmetics.
So fast orthodontics, 6-month smiles, is hot right now, I guess.
Yeah, absolutely. Yeah, we're seeing a great trend in adults. The typical patient is someone who maybe couldn't have orthodontics when they were younger. Maybe they did have orthodontics when they were younger, but now they didn't wear their retainers and their teeth are crooked again. Particularly their lower teeth, lower front teeth, tend to crowd up on them, and they want to straighten them back up again, and they don't want to go through the whole long process of traditional orthodontics, which is a longer process because we're more focused on cosmetics rather than their bite.
Okay, so you do veneers as well.
Yes.
And some people, I guess, can call it instant orthodontics. What is that, by the way? What does that mean, that term?
It's instant change. We can prepare the teeth one day. The next time we see them, they have a new smile.
Let's talk a little bit about your background. You've wanted to be a dentist since you were like 8 years old or something.
Yeah, I was 8 years old.
Really? Is that right? You knew?
Went out. Well, it's a story like that. I went out riding on my bike when I was 8, fell off, knocked my 2 front teeth out. Went to see my dentist. My dentist was actually on vacation at the time, but went down to the dentist down the street, and they fixed me up. And just throughout all those experiences of going to the dentist and seeing, wow, they can really do nice things for people. They helped me out. I also had a cousin that's a dentist and an uncle that's a dentist, so I was able to see kind of firsthand what they do. Just love the mix of art and science.
So by the time you were in high school, you knew, okay.
Oh, absolutely.
I want to be it. Is that right? And you worked in an office?
I would just observe. But I knew that I was going to kind of do an accelerated program through college. I only went 3 years of undergrad to get to dental school faster.
And you were in the Navy?
I was in the Navy after dental school. They have a scholarship program.
So you were a dentist in the Navy?
Mm-hmm. Was on an aircraft carrier, did a deployment over to Persian Gulf, working on sailors and Marines for 6 months out at sea. And I also had a residency while I was in the Navy, year-long. It's called Advanced Education in General Dentistry. So working through all the specialists there was great for me too.
Now, so moving on to today's topic, the adult orthodontics, this accelerated orthodontics.
Yep.
So who's an ideal candidate? And what are the age ranges of people that are coming in to do this?
Ideal candidate is just someone who doesn't like their smile. There's no age range. I mean, I'm looking at, teenagers to 90-year-olds. And I think I have a couple 70-year-olds right now.
70-year-olds that are getting orthodontics?
Absolutely.
Really?
Why not? Why not? They're looking for a nice smile too. They've suffered long enough with not having a nice. Yeah.
How important is the smile? Okay, so you're a dentist. Of course, you think the smile is important. How important?
The smile is absolutely important. I mean, that is the first thing people notice about you. There's studies that show that. It's always in the top of what people notice. It may be up there with hair and eyes, but I always say, nobody says that your hair lights up a room.
That's right.
Your smile lights up a room.
Okay.
So it is absolutely important. These people. They don't have a smile, they don't have the confidence.
Are there a lot of people that they hate their smile?
Oh, absolutely.
Really?
And they come in, we see them every day.
What do they say?
I don't like this gap, I don't like how this tooth is turned out, I don't like the color of this one, I don't smile for pictures. When I do smile, I have patients that cover their mouth up. I even had one of the dentists that I was in residency once in the Navy. She would do that all the time. And we treated her that first year we were in residency. Did some orthodontics, short-term. That was like my first experience of short-term orthodontics. Treated her with short-term orthodontics, did a little, some gum surgery on her. And then she was just smiling all over the place. A dentist.
Okay.
So
now I read your website and you, in a way, and I'm paraphrasing a little bit, but it's like an art form to you. Creating a beautiful smile.
Absolutely.
Really?
I love that. I mean, the mix of art and science, because there's science, the golden proportion of how things fit together and they go in with a smile, but then there comes to the point where we're actually creating it. We're either looking at the angles of the teeth, or where the shape here is. They're a little bit curved there. It's a masculine smile, the teeth square, or the teeth rounded for a female. So those are all the things that I love.
So what are the categories of the cosmetic ortho that you're doing? Or I should say, what are the procedures that you use to do it?
We're using Invisalign, which is the clear aligners that come in and out. We're also doing 6-month smiles, which is the short-term orthodontics, clear braces, basically.
And it's different than regular braces.
Different than regular braces. The brackets are, the little things that bond to the teeth are white, and the wires are white. They're actually coated with a white, so you don't see the metal wire. And we're focusing, the big difference between that and adult,
because you like regular orthodontics.
Oh, I love regular orthodontics, and it oftentimes depends on what we're trying to do.
Okay.
Someone that has a joint issue, or their bite is wrong, that's something that takes longer, and that's I send to my friendly orthodontist down the street. But when we're focusing on front teeth, things that are maybe smaller things to tweak, that's why it takes a little bit shorter time. We're doing more focus on the smile.
This is about like 80% less than a full mouth of veneers.
Absolutely. If I'm doing a full case of veneers, I mean top and bottom, all the teeth, it's probably a fourth of the cost.
So well, good. Okay, so let's talk a little bit about Invisalign. Okay. For a moment, who's an ideal candidate? And also, I guess teen Invisalign is hot, or is it hot? Is that one of the things that people?
Yeah, we see some teenagers.
It's mostly adult.
Mostly adults. We're focusing mostly on adults. Probably 80% of my patients had braces before.
Oh, really?
Yeah, and they didn't wear their retainers, so now their teeth have crowded back up or spaced back up again, and they don't want to go through that again. They don't want to have braces on again. They don't want to have to deal with cleaning them and brushing them. That's my favorite part about Invisalign, not beyond the obvious that it makes your smile amazing, is that you can clean your teeth. You take them out, brush and floss like you normally would.
Now, knowing you're coming on the show, I'm looking at people's teeth, and it seems like the bottom teeth are the ones that are crooked.
Bottom teeth, yeah, and that's the ones that crowd back up.
And they show the most when you're talking, obviously.
They show the most when you're talking. Your smile you see when you smile, your bottom teeth you see when you're talking. And most people don't realize that until I tell them that, and they say, well, I noticed that. I was out at my meeting, or I looked at everybody's teeth while we were there. Look at that. Okay.
Yeah, you pointed that out.
Yeah, you pointed that out. I'm glad we're doing that to mine.
And so with Invisalign, it's pretty straightforward, I guess.
Very straightforward.
And how crooked can the teeth be?
They can be pretty crooked. I mean, I'll do cases that are longer term, versus the 6-month smiles. I'm doing shorter term stuff. If I'm doing something that's going to take a while, I'm using Invisalign. But I can do some pretty amazing stuff.
And so you can get, like you mentioned, 70-year-olds. They're getting Invisalign?
Yeah, absolutely.
Because 70's young, I'm just saying, though.
70's young.
But the teeth aren't too far gone or established to do that.
No way. No way.
That's happening.
And if their teeth, I mean, I'm straightening teeth because their teeth look good, but they're not straight. If I have a 70-year-old who has worn teeth or yellow teeth or that kind of thing, we're probably leaning towards doing some veneers, instant orthodontic stuff. But a lot of our 70-year-olds have been taking care of their teeth. It's much different than it used to be. People were in dentures by the time they were 70. Now everybody has their teeth. So we straighten them up for them. They're doing different things in life. They're, maybe they're divorced. They're looking for a new mate.
Are there events that trigger them?
Oh yeah, they could be looking for a new job.
Okay.
We got people that are getting married. Lots of people that are getting married. The age range of my patients.
For the photos?
Oh, absolutely. I want the photos. I had a patient that made me a deal. I have to have them off before my photos. So I think we took them off like the Friday, and the Saturday was when she had her photos.
All right. Now you brought some photos.
I do.
And you're very proud of these photos.
I love these photos.
Okay.
That's my favorite part.
All right. All right. So what are we looking at here?
This is first patient. This is Brian, orthopedic surgeon.
Okay.
Came to me saying that he wasn't confident with his smile. He's seeing patients. He's talking about big, expensive surgeries they're doing, and he doesn't have a smile. He says, doesn't have the credibility.
Really?
Oh yeah, credibility is a big thing for especially professionals.
So he feels like people are staring at his teeth. His patients for orthopedics. Very interesting.
Yeah. He didn't like his canines. His canines are kind of sticking out a little bit. Of course, he didn't like the gap in between his two front teeth. And he had this tooth that he had to the side here that he actually hit it when he was, I think he said in college, he was playing rugby or something like that.
Okay.
So he's had this for 20 years, this tooth. It's been getting darker and darker, but been bothering him for that long. So we did Invisalign,
Now, when you see this, by the way, he comes in for the consult. Do you see that end in mind, and you say, "Wow, this is going to be good"?
Oh yeah, especially dramatic stuff like that. A discolored tooth, gap. I'm like, oh, that's a slam dunk. We're going to get a great result.
All right.
Great result. So when we were finished, we put the canines back in. We did some bleaching on that front
Very
tooth. Shaped his teeth. I always do a little shaping whenever we're done. If there's any chips or the around this corner there, around that corner there, to kind of put it over the top on the end. Great result, and he's ecstatic about it.
What does he say when it's all done?
He says he loves it. He said, I smile all the time. I'm not embarrassed
anymore. Do you
anymore.
think there's a lot of people walking around Ohio, Columbus, wherever in your town, that you think they're mad, they're serious, they're in a bad mood, but they just don't like their smile?
Oh yeah, people don't smile enough when they don't have a good smile. I was even reading something that says that, even your benefit for yourself, when you smile, other people smile more.
Okay.
And when you smile, you elevate your mood, and somebody else smiles, you're elevating their mood.
It's like contagious.
Yeah, your blood pressure even goes down when you smile more. So you can actually help other people. You're like helping multiple levels of people. You give one people a smile, they smile at more people, they smile, so that helps them too.
Okay, good.
Well, here's another one, Randy. This is Alyssa. She came to me, again, not confident with her smile. She was, I believe, I think she had just gotten engaged when we saw her. We have kind of a joke in the office. The age range of patients we have a lot of the time that we see them, we straighten their smile. They're either engaged, pregnant, or married within a year.
Their smile makes that big of a difference.
I have to think that that's a big part of it.
Okay. Well, that's a pretty nice smile, though.
Yeah, but she didn't like it, Randy.
Okay.
If you look at it, she's got a chip in the front tooth.
Okay.
And look at the left side of her mouth, how different it looks than the right side. Mm-hmm. It's not symmetrical.
Okay.
Symmetrical is what we're looking for. Symmetrical is what your eye sees. Your eye sees symmetry. It's beautiful. Okay. She's got the chipped front teeth. Her front teeth are a little bulbous.
Did they say, what can you do? I mean, what is their thing? Do they come in and self-diagnose? I need this, I need that?
Well, they want straighter teeth.
Okay.
I mean, it's basically that. And she's also, her lower teeth are not straight. She says, I want straight teeth, doc. I'm getting married.
Okay.
I just got engaged. I got a new job. And here's her after, which is beautiful.
That's very nice. That is a big difference here.
Symmetry. Put those side by side, Randy. Look at her before. Doesn't look feminine, not symmetrical. Lower front teeth are crowded. Look how big she's smiling in the after.
Very nice.
And I talked to her just a couple weeks ago and said, what has this done for you? She said, well, I'm in meetings now. She's got to moving up the ladder. She's like, I'm more confident. Before I was in meetings, like, are people looking at my teeth? Okay. And she's the one that says, I even noticed more about other people's teeth. She's like,
there is credibility. When I look at the before and I look at the after, I mean, there's definitely a credibility. Almost like more sophisticated.
Absolutely.
Teeth. Okay. All
yes.
right.
Here's another great one. This is one of my favorite ones. This is AJ, cheerleader at Ohio State.
Okay.
So public eye. His biggest concern was, I'm out in the public eye. I got fans that are wanting to take pictures of me. They always want take pictures with the cheerleaders, with the mascot, all those things, and he didn't want to take pictures.
Like when you diagnose this before, what do you see and what do you feel like you have to improve?
I see for him, his lower front teeth are not straight.
Okay.
I see that he's got a pretty good gap in between, kind of a rotation on his lateral incisor, the one that's right beside the two front teeth. And his two front teeth are kind of turned in a little bit. The outside edges of them are longer than the inside edges. And he's also got some dark holes on either side. When you smile, you want that broad smile that fills the entire lips. Lips are part of the smile too. It's not just the teeth. It's how the lips frame your teeth. Okay. And when your lips show those dark areas, it's not aesthetic.
So for him, Invisalign or the 6-month ortho?
We did Invisalign for him.
Okay.
He was.
Oh wow.
See, look at the before on him. Look how much bigger he smiles.
Yeah.
I was excited. You can see more.
When you put them side by side, yeah, I guess it is a huge
side by
difference.
side. You can see more of his lower teeth. You can see how his upper teeth follow his lip. The symmetry there. It's just a beautiful smile. And he right now, he was a dance major. He's on Broadway now.
Okay.
So I don't know, I could always take some credit. I can take some credit.
Do you think maybe the teeth, because it builds the confidence so much?
Oh, maybe? Confidence. If you're going to smile, I mean, say you're at a dance audition or on Broadway. If you don't have a big smile and you're not confident, you're gonna pick him over the guy over there that is smiling.
Good. So there's thousands of people, and we've talked. I said, maybe I'm insensitive to it because my teeth have been pretty good my whole life, for the most part. But there's a lot of people that are walking around that don't like their smile. Is it the fear of the dentist? Is it they think it costs more than it really does? What is it? What's the hesitation?
Those are two good ones. Costs more than it really does. I get a lot. Time is a big thing. Oh, it's going to take me 2 years. Braces. I'm going to have to wear those for that long.
Okay.
Or just finances. I couldn't do it before. My parents couldn't do it. Now I can. I got a new job starting. I want to do this now. It could be the big transformation period of I'm in college now. Maybe I got a little extra loan money. I'm going to go to the job market. That's usually what keeps people from doing it.
Okay. So now the 6-month orthodontics that we're talking about. It's different than traditional orthodontics. You're just straightening the teeth that show.
Yep.
But it's much faster than Invisalign.
Yes.
And it's for people that want their teeth straightened quickly.
Quickly, yes. And they have it's a different goal. If there's more complicated stuff we're doing Invisalign. I kind of use them both. But it's people that don't want to mess with the trays.
And there's really not the colored wires at all. They're white wires.
They're white.
Okay.
Absolutely. Everything we use is white. The white rubber bands we tie them on with, everything's white. So even in photos, you can't really see. I have photos of patients in the braces. You can't really see them very well.
Okay.
But it's that person that there may be some movement, certain teeth that move a little bit easier if I have something to grab a hold of them with. Not the aligners that snap in and out. A wire sometimes will move that a little bit more efficiently. That's where I get some of the time. Some of the Invisalign movements will take me longer because it's more complicated.
I mean, Invisalign it's like traditional orthodontics where it could take 2 years.
Yeah.
6 months is this orthodontic.
Yes.
But is it true that the critics about Invisalign, I mean, they like it, but they say, and they've tried to explain to me that the problem is patient compliance. If you eat 4 or 5 times a day, taking them in and out 5 times a day, good luck.
Yes.
And then they throw them away in napkins because you can't see them.
Yep.
Do you get that?
Yeah, we get patients that lose them. More it's patients that aren't wearing them. The more you wear, I harp on that all the time. The more you wear them, the better it's going to go. You wear them all the time, it's going to be smooth sailing. You don't wear them so much, because then sometimes you almost start over. You do what we call a refinement, which is or a mid-course correction. Mid-course correction is a big Invisalign thing. Is when you're halfway through and the liners are not really fitting anymore and teeth aren't moving like we thought. We kind of start from there again, take new impressions and go to Invisalign and get more trays. So that's the type of and if people are honest enough about themselves, say I'm not going to deal with these trays.
But 6-month braces, by the way, isn't it a tiny bit less than even Invisalign?
Time-wise?
No, as far as pricing, it's about the same?
We've priced it about the same just to make it accessible for all our patients. I can discount sometimes 6-month smiles a little bit.
To friends and family.
But there's a larger fee that we pay to Invisalign. It costs a lot more for us to do it.
Oh, really? Okay, good. But, I mean, if you had to say one's better than the other,
I wouldn't say one's better than the other.
You won't say one's better than the other.
And they both get the same result. The result's what I'm worried about.
But one is a lot faster.
One's a lot faster.
I think when I look at a woman that's 40 and she's wearing orthodontics, it seems like it makes them look younger.
Yeah.
It's a younger look.
Yeah. Or that people, I have patients all the time that tell me I'm getting compliments on me having braces on.
Is that right?
Yeah, they say, well, people tell me, wow, I'm really proud of you doing this for yourself.
Oh, good.
Oh, yeah.
Good. Now, for the sake of time, we have to kind of go quickly if you have more photos.
I do.
So what else do you have?
This is Martina.
Okay.
Beautiful girl. Beautiful smile already.
Yeah, I mean, that's a perfect smile.
But she doesn't think so.
Okay.
I don't think it's perfect either. She's got this gap.
A little gap.
She's never liked the little gap. She's got a little chip out of the edge of the one tooth as well.
All right.
And this tooth is a little rotated a little bit, and that one's a little longer than the other one. So, small changes, big difference. She was getting married. She's had her wedding photos. She made a deal with me. She said, I have to have these off for my photos. And it was like 4 months away. So I said, we can do it. 6-month smiles. But 6 months can mean 4 months sometimes. Sure. Here's her after. Beautiful.
Oh, boy. Yeah, it's very nice.
After close-up. 6-month smiles, close the gap, smoothed off the little chip. And look at the difference here, Randy. Small differences, but big differences.
Yeah.
Closed the gap, conjured the teeth. We even whitened her. Every one of our Invisalign and 6-month smiles, we whiten. It's a beautiful smile.
Because prior to, and I'm not trying to side with you, by the way, But I was thinking, how do you get better than this?
This is how you get better than
That's
this.
how you get better than that.
Following the lower lip line, whiter, brighter. Close the gap.
So one of your favorites, by the way, because I overheard
This is one of my favorites. It's a dramatic one. Dramatic.
Okay.
Almost like a life change. This is Kristen. Came into us. College student, Ohio State. Obviously didn't like her smile. She has what we call a crossbite, which is one of her front teeth, when she bites down, is behind her lower front teeth, which is not what it's supposed to be. Dramatic.
So she
change.
didn't smile because of it?
A lot of people don't smile, Brandy. If they're embarrassed about it, they don't.
Okay.
Or you see them in pictures, they smile and it's just no teeth in the smile, which
You can spot that, like when people are smiling, hiding their teeth?
I can spot that.
Okay.
I used to do it, by the way. When I knocked my two front teeth out. I got dental implants I didn't have until I was in college. And there's a funny story. We were looking for photos for our website, old childhood photos, and I asked my mom for a photo of me smiling when I was younger. She didn't have one.
Wow.
No smile. I always not showing any teeth because I was embarrassed because I didn't have my beautiful implants that I have now.
Okay. So this gal, for her, what'd you do?
Invisalign. There's a longer treatment time. But here's her after. Her after is this is a girl. This is a beautiful woman. I mean, Randy, I'm a dentist. I think the smile is important, but look at the difference.
I think anybody would agree, right?
Anybody would agree.
It makes a big difference.
Look how she presents herself, before and after.
Do people get emotional? When it's done, they look at their mirror, brackets are off, or whatever.
They do. The thing about Invisalign is it's not as
slow.
It's slow, but I mean, because they can always see their smile on the way. The big emotion ones are the veneer cases and the 6-month smiles, because it's so fast.
Did people say I should have done this years ago?
Oh,
like
always.
with this gal
Always.
here?
Always. Well, she always wanted to have it when she was a kid. Couldn't afford it. Parents couldn't handle it. She could now.
Okay.
Always. I wish
And you have men and women. I see you have a man coming up here.
I got a man coming up.
Is it more women, though, that are taking care of their smile?
I say 50-50.
Really?
Yeah.
Okay.
Maybe even more guys. I mean, probably older guys than anything. Which I don't see any difference. It's
Okay.
everybody.
Okay.
Yeah. This is Mike. He's in marketing. Wants to.
Looks like a friendly guy.
Yeah, great guy. This is a great case where a smile can change the whole look of his whole face. And you look at his. He's okay smile. You probably think it looks all right, but he's got a front tooth that's got some discoloration on it. He had some old bonding done years ago.
All right.
Didn't like that. That tooth is sitting out a little bit. It's rotated. He's got the dark holes in the side of his smile.
The size of his mouth. So you want to bring that out.
We can broaden that with orthodontics. We do it with veneers, but with orthodontics we can broaden the smile as well. And here's his after.
It looks like $1 million.
Beautiful. $1 million.
Yeah.
New man. We did the Invisalign for him. We did some bonding. We did whitening. Every one of our cases we always do whitening. When you look at the before and after side by side, he's got a different personality even.
Yeah, it does.
Smiling bigger. He maybe looks more clean cut. Looks almost more respectable. Not that he's not respectable.
I mean, in the
but,
dating scene, a guy like this, obviously I don't know anything about the guy, but it does make you look better.
Oh yes, trying to go out and date someone with crooked teeth. I had a patient in for a consult was saying, I said, well, when has this been bothering you the most? That's the question we ask. When does your smile bother you the most? She said, well, I had a guy that I was interested in, and he said something about her jacked up smile. I said, I said, first of all, that's not the guy you want to be with. We're going to straighten your smile up, and you're going to get the right guy.
That's bad.
Yeah.
But that's so it's very interesting. I think that is your kind of struggle. I mean, now that I've looked at this, because I always think you guys are exaggerating. Oh, a smile makes such a big difference, but it does make a difference. You can see this.
Huge
But is that
difference.
your thing that you have to deal with, that the public doesn't realize? And there's a lot of people, they have the means. They care about the way they look. They've got the fancy car, the watch, the $2,000 bag, but they don't see the smile as being that important.
I think they may see it as important. They don't know how important.
It's a fear of the dentist?
Or they don't know that it's how easy it is.
Okay.
I get that all the time. The patients, I didn't know it was going to be this easy. I didn't know it was going to be this smooth. We see every month or so, give you some more liners or adjust your braces. We got them off. You're done before you know it.
And pain is not something that these people complain about.
Not too much. There's some discomfort anytime you're moving teeth around, but
So
no.
for the highly anxious, because your office does IV sedation, people
We do?
can go in, they're out, they wake up and they have a beautiful smile.
Mm-hmm.
That's not an exaggeration. I mean,
It's not an exaggeration. Absolutely. You wake up and it's like night and day. Smile, no smile.
and you see transformations every week in your office.
Mm-hmm. Every week. Great ones. I mean, these are my favorite patients. I love to tell the stories because it's almost like it's your kids. These are your cases.
All right. So adult orthodontics, 6-month smiles, Invisalign, teen Invisalign, all good things. Now, final message, and we're out of time. Good stuff, by the way. And all of these photos are on your website. They could do it there.
Most of them are on the website.
Consultation, they could go see you.
Free
face to face.
consultation.
Free
Give us a
consultation.
call.
No, and people don't know that either.
Yeah,
I
they
was
think it's
afraid-
going to cost to come talk to me. You come in, I'll talk to you for an
My
hour.
office manager called 2 dentists, and one had a $250 or $300 consultation. And I told her, I said, you got to call somebody that doesn't have a consultation. That's at least how I feel.
Yeah.
And so good for you. And that way they know their options.
Absolutely. I mean,
You have some fun on those consults
charge.
because everybody's afraid of the dentist, right?
Oh yeah,
Nobody
I'm just
likes
talking.
going to
Like
the dentist.
people are like, oh, I'm scared. I'm like, we're just talking. I'm talking about everything. I want to take a look.
What's your line when they say, is this going to hurt?
Sometimes it depends on the person. Sometimes I'll say it's not going to hurt me a bit, but I'll say absolutely
probably
not.
rarely
Absolutely
say
not.
that, though.
Absolutely not.
Good for you. But again, final message, somebody doesn't like their smile, what do you say to them?
Give us a call.
Okay.
You don't like your smile? Come to our website. Check out the photos. Give us a call. Doesn't cost anything to talk.
Good. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com. And you could put in Dr. Hoellrich, which will be tough for them to spell. So they could put in OH Dentist. That'll be another way we'll have you searchable there. And for those of you on Twitter, if you want to compliment Dr. Hoellrich or make a comment about today's show, it's hashtag the Wellness Hour. For now, I wish you good health.